It may be hard to distinguish between outer and inner ear or middle ear infections as it's more accurately considered. I think that the best thing to do is if you're unsure is to see an expert or see your primary care doctor, and they can diagnose you with an outer ear versus middle ear infection. I see patients with ear pain for a multitude of reasons. If it's some sort of foreign body or an impaction of wax, then we remove that and that will relieve the pain. But there's other causes of ear pain. For example, eustachian tube dysfunction can also present as ear pain. Your eustachian tube is a tube that connects your middle ear space to the back of your nose. Think about it like if you're on an airplane and you're trying to pop your ears, what you're doing is blowing air from your nose into the middle ear space to help equalize the pressure. And that's what the eustachian tube does. If you have a cold or a sinus infection or some type of virus, this eustachian tube will get blocked, and that can cause ear pain. And that ear pain is more in the middle ear, but it's really hard to distinguish for you as a patient, is this an outer ear or middle ear issue? So that's why you should definitely see a doctor.